The Psychology of Sleep, Benefits, Effects and its Treatments. By the Natural Health Care Institute. Have you ever stayed up late, looking at your ceiling wondering, is that the sound of time I'm hearing? We sometimes get too comfortable zoning ourselves out, and letting our time pass as if we have more of it. Some of us are like this every night, just letting the time pass with abstract thoughts like crumpled wire connections. It might be normal to have such difficulties falling asleep when we encounter common life problems. But staying up late while contemplating about our existence, and feeling the world spin slowly, are not very usual for every people. There's a lot of sleep problems needed to be addressed in a clinical setting. Today, we will be focusing on two of the most common sleep disorders: parasomnias and sleep paralysis. Parasomnias. Parasomnias are abnormal sleeping behaviors. Some examples for these are sleep terrors, sleep eating, sleepwalking, sleep sex, rapid eye movement (REM) behavior disorder, and any other possible actions that happen while the person is asleep. This disorder is hereditary or some existing brain disorder like rapid eye movement. A brain disorder that occurs usually for men 50 years and above. Are the triggering factors of this? Parasomnia has no specified age subject, meaning even children can possibly be diagnosed with this. The good thing is that it cannot be associated with other medical conditions, and studies show that it disappears in the process of growing up. Example situation: Jack slept beside his brother Jerry. Around 4 a.m., Jerry suddenly woke up when he felt Jack went off and walked towards the door, asleep. He slowly followed his brother and redirected him silently back to bed. In our situation, Jack is experiencing sleepwalking at night. The approach Jerry did is the appropriate action needed to everyone experiencing this disorder. People who are in parasomniac in action shall not be awakened, especially by shaking or shouting. Doing this might result in an aggressive response and might trigger irritability. Natural treatments like improving sleep habits and learning to handle stress in a balanced way can minimize to completely treat parasomnia. However, one should get a different treatment when there is risk or injury present to the people around the person diagnosed. An overnight sleep lab study should be conducted for this. Second, sleep paralysis. Sleep paralysis is a frightening situation. Most people encounter this right after waking up. It's a condition characterized by the inability to move while transitioning from sleep to wakefulness. Often, this condition is associated with hallucinations. According to further studies, about 25% of normal people are affected by this condition. Sample situation: Mary opened her eyes, she just woke up. Her eyes started roaming in rapid movement as she felt concealed and pushed down against her bed. She can't move her body, but she can hear everything around her. Mary experiences sleep paralysis while in transition to wakefulness. Some people claim this is a paranormal experience when it's actually a sleeping disorder. The horrors of sleep paralysis may also be associated with the basic symptoms of narcolepsy. Sleep paralysis can be diagnosed easily if these symptoms are present. Rapid eye movement or REM often occurs while sleeping on one's back. Visual and auditory hallucinations occur, e.g., hearing voices, assuming devil's presence, feeling of being observed, or feeling sensitive touches. Feeling someone is beside your peripheral vision. Chest pressure resulting to breathlessness. The horrifying symptoms of sleep paralysis are commonly experienced by 20% to 60% of people with at least 1 to 4 more episodes. Fortunately, it is totally harmless, and there is no risk of dying with its episodes. That is why there is no actual treatment for sleep paralysis. However, if the episodes occur frequently and the distress became unable to bear, SSRI or selective serotonin receptor inhibitor may be prescribed for the patient. SSRI is an antidepressant used to treat major depressive disorders too. If sleep paralysis ever happened to you, It is important to make yourself remember that it is not real and you're fully aware of what's happening. Relax your mind and it will resolve by itself in a few minutes. Why is sleep a big deal? We all need support, and our helping hand in keeping us at phase with our everyday life is sleep. Whatever you feel while you are awake reflects based on the amount of sleep you got the night before. Imagine battling a difficulty sleeping every night and having to wake up early in the morning to work. It's such a disaster. Sleeping helps our growth development. It prepares and keeps our guards up to face the next day full of hopes and beginnings. Some of the studies show that it helps us improve learning, especially with problem-solving skills. If you're experiencing a sleep-through problems for quite some time now, it is important to listen to your body and ask for a professional's help. Fixing it early is much better than learning to cope with it and living uncomfortable your whole life. Aside from the given symptoms above regarding sleep disorders, there are also some minor symptoms you may want to monitor, which tells that you might be sleep deprived. These are using alarm clock, difficulty getting out of bed, relying on snooze button, getting sleepy at the middle of a supposed to be productive day, feel the need to sleep on weekends, and falling asleep within 5 minutes facing your bedtime. There are so many effects of sleep-through problems, and we should not let time pass by living with it. More than stress, our wide circle of interaction can be affected by the way we communicate to them based on our moods. Sometimes, there are causes deeper than our personal problems that make us stay late at night. The exhausting feeling of needing to take a rest, but the rest rejects you is difficult to ponder. Some causes are more than just distractions that cannot be eliminated without the help of medications or professionals. There is nothing wrong about seeking help and sharing how hard you're going through. We are living with options and continuous development of technologies and studies to help us ease our lives. If you like this video, don't forget to hit the subscribe button to be updated with our upcoming contents. Thank you for watching.